Right, my son just walked in, so he wants me to iron his stuff for him, but he's actually said, can I teach him for the first time, which is great. So yeah, life skill. So yeah, my name is Susan Wilcox. I have had a diagnosis of bipolar since 12 and a half years ago. I would like to make awareness for this condition and to educate people on what it is as a condition. If you look it up, we all know a lot of famous people have it. And my point is, you wouldn't judge Robin Williams if he was diagnosed with it. I know he had really bad depression, but it's possible he had the mania side of it, which was hypomania is a very constructive side to the illness. So you can be very creative during those episodes of hypomania. So yeah, with his talents and everything, we all know Robin Williams was an incredible man. I am just a regular woman. I have 3 teenagers. I am a cleaner. Shout out to all the cleaners out there and housekeeping staff and all the other jobs I've done. Big, massive shout out to people. So, as of last Thursday, the week before that, I was starting to get very a little bit high again. I had been out of work February onwards, and that caused me to have quite a low because I didn't have a focus, and not working isn't a good thing. I'd had a lot of things going on and I decided to not work for 3 months. So now I've been working 2.5, 3 months again. I am a lot better. So with the bipolar, if you're not on your downs, you can go to high. So last Thursday, luckily my sister realised I was a little bit up and I got an appointment with the Bath PCLS team, who saw me very quickly, and they spoke to my doctor and they spoke to a psychiatrist. It's not a scary word. They go to university for 7 years and that's what they do. They help us. They're a specialist in problems with people's brains. Let's face it, that's what it is, okay? And if any other organ was failing, we have doctors that are incredibly talented that deal with those as well. So yes, psychiatrists, we like them. Thursday's appointment, I was told to come off antidepressants because they can elevate your mood a bit too much, and I've been on them for 13 years, I've realised. So withdrawing from antidepressants since last Thursday has been pretty tough. Lots of sort of dizzy spells and lots of things like that. So I was then also, I was taken off antidepressants. I take a mood stabilizer, which is called lamotrigine, and that works wonders. The lamotrigine is actually used as an anti-epileptic, anti-fitness, anti-convulsant. Sorry, I'm not a doctor. I'm trying to educate as much as I can from what I've been through. So yes, I was taken off antidepressant, continue with the mood stabilizer. They've upped that a little bit. And then recommended that I go back onto the quetiapine, which is hard for anyone to think, right, I've got to go back on something that's quite a heavy drug. So the quetiapine is an antipsychotic, another scary word that people will judge. But it basically just means it will pull you down from the hypomania side of it. So I've been on that for a week and my sleep is a lot better. So I have slept pretty well the last 3 nights. So yeah, I just made this video really just to try and make awareness for people like myself who don't have a voice. Sometimes we go into appointments, we are handed medication, we don't know how they're going to affect us, and it's, you know, very brave to do something like this. And I set you some homework. Why don't you Google famous people with bipolar, because you'll be shocked. Some of you will already know, but yeah, it is a thing, and I am a female bipolar sufferer. I wouldn't say sufferer, because once you know everything about the diagnosis, you can manage it, and that is the battle. It's managing it in the best way possible. So I don't drink alcohol excessively. I could have one, but I don't drink above one. Steer clear of any substances apart from the ones that are prescribed. You know, everyone does it differently, but over the years of trialing different prescriptions and, you know, making mistakes of drinking and having a dip after, as alcohol is a depressant, I have learnt what suits me, and that's the battle, isn't it? Knowing what suits you or what helps you. So yeah, a week into my new treatment, I feel good. I'm still up a bit, but I'm hoping that I will even out and I will not dip, because that is what I was very scared of. Was this is big for me. I have not been off an antidepressant for 13 years. I've always had an antidepressant. My first diagnosis was depression, and then in 2013 I got a little bit high from one of the antidepressants, and that was what then that's what then suggested to the GP that it wasn't just depression, there was bipolar. So with bipolar, it's very up, down, and yeah, that's basically it. So there are a lot of different types of bipolar. There are 20 different types. Some people have very low lows for a long time, and then they will have highs for a long time. Then you get the rapid cycling bipolar, which means on a daily basis you can be up, down, up, down, up, down. It's basically like a roller coaster, and you learn to ride it. That's what you've got to do, is just embrace it and not be scared of the lows, or frankly scared of the highs, because with a high you could there's a lot of things with bipolar. You could be very impulsive, so with a high you could feel great and you could just go off and do something, and you could put yourself at risk. This is why I want to raise awareness for bipolar sufferers, because on average it takes 10 years to diagnose, and if I'd had a diagnosis sooner as a teenager, I do believe I would have had an answer to why I was struggling, why the way I was, and possible intervention and treatment a lot earlier on, because as a teenager I suffered a lot with alcoholism, some drug use, and obviously that exacerbated everything. So to have been aware back then could have saved a lot of trauma and a lot of things that happened that were basically due to alcoholism, taking risks, and things like that. So if I could save anyone that is younger, that is struggling with, there's a lot of teenage depression out there, but if me making this video could sorry, I can't get my words out sometimes, that's a symptom of some of the quetiapine that I'm on. It makes you very drowsy in the morning, you get constant dry mouth, hence why I'm always putting Lipsil on, and I spray my mouth a lot, and I use boiled sweets, sugar-free chewing gum, that sort of thing. We all have, you know, ways of having to deal with the side effects. So yeah, I think I've pretty much covered what's going on with me today. I am going to have a good weekend, and it's all about being mindful and not overdoing things, making sure you're resting enough to recover and to go back down to an even level, which is what the lamotrigine is also for, is the comfort blanket of having a mood that is stable. Yeah, it's been a very tough week. I won't go into it, but yeah, if I can raise any kind of awareness and help anyone out there that is struggling with bipolar, I would like to do that. I feel like I could be an advocate now because I've been through 2 hospital admissions with mania, and I've had depression for 2 lots of 3 months. The first one pre-children. And my partner, the children's father at the time, actually cared for me. I couldn't, he would get me up, get me dressed, he would help me eat, and all the sort of things. I just needed prompting. It was awful, and I wasn't put on any antidepressants back then because I wasn't too sure what was going on. So yeah, so 2 hospital admissions of very high manic phases, which were absolutely awful, and they were a result of the antidepressants. So I am very glad to come off those because they could push you into being too high. So yes, 1 week, no antidepressants. I'm feeling okay. I've had a few side effects of coming off them and going on to the quetiapine again, but I am sleeping better, and I will check in another week to see how things are going then, because I think this is really useful and beneficial for a lot of people that have the condition. It's very common, and yeah, if I can help one person, that's all I'm out here to do. Have a good weekend and take care of yourselves. Yeah,